Light therapy is a type of therapy that is used in the treatment of depressive disorders, most commonly used in seasonal affective disorder. So when seasonal affective disorder tends to affect most people is going to be in the fall and winter months when we have lower levels of light naturally from the sun. So using a light box can be very beneficial to make up for that difference. So the sun emits different light rays from blue to red. In the morning, we tend to get more blue light rays, and in the evening, we tend to get more red light rays. So light therapy has a high concentration of blue light in it. So light therapy tends to be more effective if we use it in the morning when we would naturally get higher levels of blue light from the sun anyways. So there are different types of light boxes, and light boxes are measured in lux, which is the standard unit of measurement of light intensity. So you can get a light box that has 10,000 lux, or you can get a light box that has 2,500 lux. The main difference between these are going to be how much time you have to spend sitting in front of them to get the benefits because of the difference in lux. So a 10,000 lux box, you can typically sit in front of for about 20 to 30 minutes and daily, and within about 10 days, you'll notice a benefit, okay? A 2,500 lux unit, you're gonna have to spend closer to 2 hours a day in front of that unit to get the same results that you would get from a 10,000 lux box in 30 minutes. So there's a wide variety of what's out there, but the 10,000 unit lux boxes are going to be the most common ones used in research and typically yield the best results because they are the easiest to use because compliance is higher because you don't have to waste your entire day sitting in front of them. It's also best to use your light box in the morning almost as soon as you wake up. So within 10 minutes to 60 minutes of when you wake up, that is when you want to use your light box, okay? You want to start low and go up. So start around 15 to 20 minutes in front of your light box and slowly increase the amount of time that you're spending in front of your light box in case you notice anything adverse happen. That way you can contact your doctor or you can slow down on how fast you are progressively increasing your time in front of your light box. You also want your light box to be at a 2 o'clock or a 10 o'clock position. So that's about a 45-degree angle in front of your face because you don't want it directly in front of you because it's gonna basically blind you. So you want it at an angle, and it's really supposed to be only about 16 to 24 inches away from your eyes. So if you buy a light box and you put it on a desk and then you're walking around your room thinking, well, I have my light box on, it's actually not doing any good for you. You really need to be right in front of it the entire time, okay? And the last thing I want to talk about are all the reasons that you should not use a light box, because a light box is not safe for everyone. Just because it's a light and you think you have lights in your house, we get light from the sun, does not mean it's okay for everyone to use. First of all, if you have a retinal disease or a macular disease, you should not use a light box. The high levels of blue light that come from the light box will penetrate into your retina and can cause further damage. If you're on a medication that causes photosensitivity, you do not want to use a light box. And if you have bipolar disorder, you want to talk to your physician before you use a light box. It can be beneficial for some people, but it does have a tendency to cause mania. So you want to consult your doctor before you use a light box for that.